Hi, good evening. My name is Suzanne Tan, and I'll be doing my video presentation for the abdominal examination. So I would first like to get consent from the patient that I'm gonna record this examination for school purposes. Is that okay with you? And of course, the first thing you need to do is, of course, introduce yourself to the patient. Hi, my name is Suzanne, and I'll be your student nurse practitioner today. Then, of course, you wash your hands. So the first thing doing an abdominal exam is you would position your patient to lay flat. Okay. And sometimes it also helps in some examinations that I've seen is like if you position the legs wherein they would get it up a little bit, it relaxes their abdomen. So, but for this time, we would just ask the patient to lay them flat. Okay? And then arms on the side, and is it okay if I lift up your very, very sensitive. So the first thing we would do is, of course, do an inspection. So inspect for peristaltic movement, shape of the abdomen, make sure it's round, there's no protrusion or anything like that. Also for pulsations in the aorta or something like that. Next would be auscultation. So of course we will auscultate for vowel sounds. So on the right lower quadrant, upper right quadrant, left upper quadrant, and left lower quadrant. So it depends. There could be that the patient has he has normal active vowel sounds, but it could be hypoactive or hyperactive vowel sounds. So after auscultating the 4 quadrants, you can also auscultate the aorta. So it should be above the patient's umbilicus. So there should be no bruits heard. And also, of course, you can also palpate the femoral arteries. You can also palpate auscultate, the iliac arteries. And then the renal arteries. Sorry. So there should not be bruit. You can also use your the bell part of your stethoscope as well. So after auscultation, we're going to do percussion. So percussing, when we percuss, of course, we percuss all the 4 quadrants using your non-dominant hand. It should be tympanical over. And of course, when you also percuss for the liver and the spleen, you should be able to hear dullness. And then you would also be doing measure the liver span. So when you hear a change from tympanic to dullness, so you would mark, and then going mid-clavicular line in the intercostal space. So you should be able to measure it, and it should be about 3 to 7 centimeters. Also, palpating for the spleen on the 10th 10th intercostal space, anterior axillary line. So it's a little hard to palpate, percuss the there should be dullness, but you can't really feel because the spleen is very inside the rib. But you should be able to hear dullness or percuss dullness. So after percussing for dullness on the liver and the spleen, then you would also percuss the bladder. So it's if the patient has an empty bladder where he is, so it's a little hard to percuss it as well. So now we move on to palpation. So first is we do light palpation. So palpating all the 4 quadrants, and then we do a deep palpation. So check for any tenderness from the patient. It feels any tenderness at all, and also palpate for the liver. So you would ask the patient to, can you please take a deep breath? So you should be able to feel the liver. And also for the spleen, can you take a deep breath? So you should not be able to feel the spleen at all. As I said earlier, it's a little deep. So, it means that there's no splenomegaly. But of course, the liver should be able to palpate as well, like the tip of it, of the liver, as it goes up when the patient inhales. After that is we're going to do some specific tests. So the first test we're going to do is we have the fluid wave test, wherein you can ask the patient actually to also turn to the side. There should be fluid shift, or another way is just by doing this. Then there should be a shift from fluid to fluid, indicating that the patient has ascites. For a Murphy sign, usually you would ask the patient to take a deep breath. Take a deep breath. So, and then you would palpate deep. If the patient would stop breathing, so usually it's an indication there that the patient has some gallbladder problems, or maybe cholecystitis. Now, to check for appendicitis, now there's 4 different tests, but one of the most common tests is we have the locating the McBurney's point. So finding the anterior superior iliac bone of the patient right here, and then the umbilicus, the middle part is the McBurney's point. So you would do a deep palpation. If the patient feels any pain at all, it would indicate that the patient has appendicitis. You can also do the rebound tenderness, like when you suddenly release your hand and the patient would feel pain. Also the Robson sign, wherein you would palpate on the other side, and then the patient would feel pain. You can also do the psoas, wherein when you would bend the patient's knee, and then the patient would feel pain, or the obturator sign, wherein you would do this, and the patient would feel pain. If you do it on the other side, it can also indicate that there's some peritoneal issues or peritonitis for the other side. And then after that is you would do the check for CVA tenderness. So you would ask the patient to sit up. Can you please sit up? And if you could turn this way for me. So checking right here. If the patient feels pain, then there's some kidney issues as well. So that's how you would check for CVA tenderness. And that ends my abdominal examination, and thank you very much.